Fuller Basic School of Massage instructor. This is Lauren. She's also an instructor here at the school. We are going to mime for you guys today a typical advanced Fuller interaction between you and a client. We're going to demonstrate the therapeutic massage video. And basically this is just going to give you a kind of an idea of how you'll bring your clients back, the communication you'll have with them in the room, how the massage should proceed, and how it should end. During the video, you may notice moves that are not a part of the basic routine we teach you in class. That's totally understandable and normal. I've added in years of experience of advanced moves to my routine. You're more than welcome to take additional classes to learn those routines or use some of the moves on your own. Please don't get caught up in the idea that the massage is not quite the same. We want to incorporate some sort of authenticity here, right? Also, at any time you may hear me kind of reference moves that you have learned or acupressure points, and those are basically just for your knowledge. Okay, so what we're going to do is mime the intake process. When your client comes in, the front desk will check them in, and they will hand them an intake form that will go over any of their current medical issues and past stuff that could affect the massage today. The front desk will take care of this for you when the patient checks in. So Lauren, if you could go ahead and fill this intake form out for me, we'll get you back as soon as you're done with that. You will essentially wait off to the side until your client is done with the intake form. Once your client has completed the intake form, you will call them up and then you will take them back to your room. All right, Miss Lauren, are you all done with that?
I am, yes.
Hi, I'm Corrine.
Hi.
I'll be working with you today. Take that for you. So, do you need to use the restroom or have any water before we get started?
No, I'm fine.
Okay, wonderful. Then we'll come on back this way. After you. So, this is our first time working together. So, I just want to go through some things. This chair here is for all of your personal items. During the massage, everything can just sort of stay here. You're going to be draped at all times, so please feel free to undress to your comfort level. Is there anything in particular that we're going to be focusing on today? I do see that you have a prior low back injury on here. Is that kind of our focal point for today?
Low back pain is kind of a constant for me, and then just tightness from stress in the neck and the shoulders.
Okay, neck and the shoulders and lower back. So it says that you have a prior sports injury on your intake form. Can you tell me a little bit about that?
That is my low back pain. Back in 2012, I herniated L3 to S1.
Okay, wonderful. And are you currently under a doctor's care for this?
Just a chiropractor.
Okay. Are you okay to receive massage or
I am.
your doctor approval? Okay. Now I see you have some TMJ issues. You suffer from headaches, which probably makes sense with the neck and shoulder pain. High blood pressure. Are you treating for that? Are you on any medications for it?
No medication. I control it with diet and exercise.
Okay, wonderful. Now, have you received massage before?
I have.
Okay, about how long ago was your last one?
2.5 months.
Okay, so not too bad at all. All right, well, what I would like to do is start face up today.
Okay.
That means that you're going to be lying on your back, face towards the ceiling. Your knees are going to go over top of this bolster, okay? So I'm going to scooch this up. We'll discuss pressure and things like that when I come back, but normally an hour massage is full body, which includes face, feet, and scalp. Are you okay with all of that work?
That's fine.
Wonderful. And do you have any surgeries like nuts, bolts, or screws, any hardware in the body I should avoid?
No.
Okay, wonderful. Well, I will be back in just a second, and I'll knock before I come in, okay?
Thank you.
You're welcome. So this is the standard medical form. It's very important that you address everything circled on the form so that you can learn about it. Obviously, your additional medical questions should be covered as well. As you noted, I left some to be discussed when I come back in the room. That's totally appropriate because it speeds the medical process up. This form will be returned to the front desk. We keep it in a locked box so that it's, confidential. During the time that your client is getting undressed, it is wise for you to use the restroom where you will find mouthwash in case you've eaten something that's very strong smelling before your client starts. So you can get that out of your breath. You can wash your hands. Definitely want to make sure you're going in with clean hands. You should also kind of take a moment to ground yourself, to prepare yourself for the body work. Make sure that your intention is solely on your client and whatever it is that they're suffering from. You want to make sure that you're present and in the moment and not going to get caught up in their emotions or their body issues, okay? So, Once it's been a couple minutes, I don't leave very much time for undressing because usually clients are very excited to get on the table. I just go up and I say, "You all set?" Yes. All right, and I always kind of peek a little bit before I come in. Sometimes clients say they're all set when they're not quite all set. First thing you do when you come in is dim the lights, and then you check to make sure that your client is comfortable. Are you comfortable in this position, Miss Lauren?
I am, yes.
You feel very supported?
I do, yes.
Well, if any time anything makes you uncomfortable, like the music or the pressure or the room temperature, you just let me know and I will do my best to change it, okay?
Okay.
And what kind of pressure are you looking for today?
Medium to firm.
Okay, wonderful. Well, if any time it's not quite enough or if it's too much, you let me know.
Okay.
I usually say it's okay for it to be uncomfortable, but it shouldn't be painful.
Okay.
Now, you'll note that I'm going to start with the face and the scalp. This really can be changed depending on what your client is suffering from. So some therapists prefer to start face down and start with the back. Now, Lauren did say that she had lower back pain, but she also said that she had neck and shoulder pain. The advantage for starting face up is that my hands are already clean. I don't have any unnecessary oil on them, so it's easier for me to do the face and scalp without getting the hair or skin oily. Standard routine we teach you at Fuller has you start with the face and scalp and then work into the arms. So at this point, I'm just doing some nice scalp friction along the occiput, along the sides of the head, kind of getting into every nook and cranny. Want to make sure that you're really getting all those spots. It's kind of like coloring in between the lines. You don't want them to feel like they aren't getting touched somewhere, basically. Now, this should be fairly firm. The idea here is that you're moving the skin below your fingers, not moving your fingers over the skin. Some ear work can be done, auriculotherapy, neuromuscular ear pulls, which you learn in your face and scalp routine. I always keep one eye on the clock, especially here at Fuller where timing is very important. All your clients are back to back, so it's important that you note where you're at, how much time you have left, how much time you've spent on any given body part. When you bring your client back and you find out what the purpose of their session is, what their goal or intent is for the massage, it gives you an idea of how you want to focus your time. So I'm doing two different acupressure points here. We're doing governing vessel 24 and governing vessel 24.5. I'm going to do some nose sweeps and end myself at bladder 1. Good for eye strain and sinus problems. And just kind of slightly change my pressure upwards for bladder 2. Some eyebrow squeezes that bring us right over to acupressure point gallbladder 1, which is good for headaches. And I'm going to slide down the bridge of the nose to get to large intestine 20, also known as welcome fragrance. Great for sinus issues. And sweep across the zygomatic bone to end at stomach 7, which is right before the TMJ. If you remember, Lauren's intake form informed us that she has TMJ issues, so I'm going to stimulate this point a little bit with a light vibration. And then I'm going to do some nice deep circular friction along her TMJ, just kind of breaking up any fascial restrictions and bringing in some nice new blood flow. Some myofascial stripping along the mandible. And we'll move into some neck work. I always start my neck work without oil, just to kind of familiarize myself with the client's body and do a little bit of myofascial work before I move into using oil and warming everything up. So I'm doing some nice circular friction along the SPs, familiarizing myself with her neck, looking for crunchy spaces. She did say she has some neck and shoulder tension, so I'm expecting to find some stuff. I also do the same circular friction along the TPs. And then I'm going to lift the head and put it into a nice lateral flexion. Now it's important here that you note that the head is in a lateral flexion, not a rotation. I want to keep her chin as close to neutral as possible, and if it fluctuates here and there, I'll just move it back. So we'll start with some effleurage. And some one-handed fulling. Periodically, once you get started with your moves, you want to check in with your client. How is this pressure so far, Lauren?
That is perfect.
Wonderful. And some one-handed kneading. Some friction. And a friction all along the lateral portion up to the occiput. And when you reach the occiput, there's actually an acupressure point here called gallbladder 20. Just outside of the lamina groove, just below the occiput. Friction, friction, and then gallbladder 21, located here right in the upper trapezius area. This is a no preggers point, don't forget. Alright, I'm going to sweep around the clavicle a bit, showing those pecs that we might be coming by shortly. And then I'm going to move into kind of like a deep longitudinal along the upper traps, into the scalenes. Maybe touch a little levator scap as we go. Looking for trigger points, looking for knots, adhesions, places that I want to stay and kind of give a little extra love to. If your client is here for therapeutic reasons, it's fully appropriate to work these places. If they're here for relaxation, you may need to work within their comfort level. Ask them if it's appropriate. Hey, this is a knot. Do you want me to see if I can work this out a little bit? Do some lamina groove stripping. This is done slow. You want to allow the muscle time to melt. If you get a little knot, you can always put the muscle into some counter strain. It allows you to work a bit deeper with a little less discomfort to your client. Lauren, is that tender at all?
No.
Okay, good. Make sure that you check with your client. If you're doing something that you know is probably tender or painful or feels icky to you, it's always nice to check in with your client. Is this pressure okay? Is that space tender? It doesn't mean that you have to back off. It just means that you need to address that need. Make sure that you are letting them know you're aware it's not so great either. Make them feel comfortable enough to tell you, you know what, now that you mention it, I might not like that very much. Moving into the opposite side, a nice lateral flexion with a minimal stretch because we haven't warmed it up yet, but just enough of a stretch to kind of introduce some space here. And we'll start again with some effleurage. This time I might go just a bit faster since we're kind of more into what a regular massage would look like with a little less explanation. Things to be conscious of while you're working: your body mechanics, where you're breathing on your client. Where's your other hand? How much pressure are you using with the supporting body parts? Are you really leaning on this hand? Because if so, be careful how much pressure you apply. Notice that I'm in a nice forward lunge. I'm not bending at the waist, I'm bending at the legs. And I'm keeping my back nice and straight. My elbow is close into my body so that my body provides it the support. See how our head sort of rotated a bit? I'll just take it and sort of put it back to normal. And I'm just doing some nice deep circular friction along those TPs. Here I'm going to do kind of a clavicle scoop call it a scalene scoop. This is an advanced move that you can learn in deep tissue if you decide to take the class. Some nice duck bill. Remember, gallbladder 21 is below here. And we'll work that in just a second, but right now I'm trying to get that nice trap melt to happen. And I transition smoothly into a deep longitudinal for the lamina groove. During my deep longitudinal along the line of the traps, I'll stop at gallbladder 21. And I'll slide all the way up to gallbladder 20. So as you can see, you can work acupressure points in several different ways. Each side of the body does not have to be exactly like the other side of the body. As long as you are still touching all the same spaces, your client is not on the table memorizing your routine. Now that we've kind of gotten through most of the basic routine, warmed up the side and a little bit of the back of the neck, I'm going to head into head rock. Now, Lauren's really great at relaxing, but some clients do not always allow you to do this. Sometimes you might need to have a conversation with them, like take a couple deep breaths. Try to sort of just give your body up to me. I try not to use the word relax very often because it often does the exact opposite. But you want to do something along the lines of make it heavy, be a rag doll, be limp like a noodle. Head rock is going to traverse me all the way down to C7T1, and then I'm just going to do some hand under hand effleurage back up. Did something mean, now I'm doing something nice. You can move into lateral head rock, also known as counter strain and strain. I prefer to do one side at a time. I think it makes the client less dizzy. It's important that you utilize body mechanics here. My stool is rolling, not me. And I'm going slow so that the client doesn't feel like you're jostling their head all over the place. If you find something icky, you can do just a little bit of friction. See if you can break it up a bit. That was something mean, so now I'm going to do something nice. Switch hands, move into counter strain for the opposite side of the neck. The whole time her nose and chin are pointed straight upwards.
That side's more tender.
Ooh, good to know. Client feedback is a wonderful thing. They don't always give it to you, so you can always feel free to ask or encourage them to tell you. Would you like me to back off some, Lauren, or is this pressure okay?
Where you are is fine. It was more tender, higher up.
Up high. Okay. So sometimes, especially if it's a newer client, if they mention to me that something is tender, I often will check with them that the pressure is okay, because sometimes that's your client's way of letting you know they want you to back off. And they're not comfortable saying, can you lighten the pressure up? So make sure to double check if they give you any feedback of the sort. Don't immediately assume you need to back off. Some people just like to let you know when something is not quite right. It doesn't necessarily mean you're doing anything wrong or that you need to lighten up. It means you just need to check. I'm going to go back and revisit the spot that Lauren told me was bothering her. Is that it, Lauren, or should it go higher?
Right there.
Mm-hmm.
And that refers about to right here.
Oh, okay. So oftentimes with referral pain, it means there's a trigger point of some kind. At this point, you can work your way through our trigger point verbiage, which you'll learn during the class. I'm basically going to hold sustained pressure and ask Lauren to let me know when the pain is at a 6 out of a 10.
Right there.
Okay? Take just a couple deep breaths for me. I usually would check at this point if it was referring anywhere. Obviously, she's already told us it's referring to almost above the eye, it looked like.
Mm-hmm.
Okay.
Starting to subside.
Wonderful. Once you've held for about 20 seconds, you can ask them, is it feeling like it's relieved at all? She's already let us know that it's starting to release, and I can feel that it's softening as well. Now, in a normal trigger point protocol, you are to follow the referral pattern looking for an additional trigger point. Sometimes in cases like these, you're not going to find a trigger point here in the scalp. I often will just go here and try to sedate that referral pattern with a little bit of pressure and love. One of the big things to remember about trigger points is that anytime you deactivate a trigger point, you must do a PNF. I prefer to do my entire neck routine before moving into all of the stretches and PNFs, but we're actually pretty much done. We only have the hour for today, so it's appropriate to spend between 10 and 15 minutes on the neck. Scalenes lift. And I'm going to move right into stretches. So our 3 stretches are lateral flexion, which will work out that trigger point quite nicely. I'm going to put her into a stretch. Once I feel that she is at her end feel, I'm going to encourage her to resist against this hand with 30% of her strength. Take a couple deep breaths. Keep pushing. And at the end of this exhale, go ahead and relax. Lovely. Following through to her new end feel. I'm gonna laterally rotate the opposite direction and just do a stretch. You can do a PNF here to make things even. For time purposes, we're just gonna leave it here. I call this the cross arm stretch. It essentially is you stretching the extensors. So you put the neck into flexion and push up. If you wanted to PNF, they could just resist against your hands. I also like to leave my arm stretched, and I'll do a levator scap stretch by rotating my arm up and out like a windshield wiper. Nice stretch for the levator scap. I'm going to control this head so she doesn't feel all floppy, and switch arms. Rotate. Oh, sorry, Lauren, you all right? And some nice traction. At this point, you move into the arms. You have to have some sort of transition goodbye move. Stand up without breaking contact. Really, from the moment you make contact at Fuller, our philosophy is not to break contact. You need the arm to be slightly rotated out towards yourself. I like to call it the robot arm. So that you can get inside the bicep area here. When I do the arm, I always incorporate a little bit of pec. You've got your fulling. Maybe some friction. Paying special attention to attachment sites. Always make sure you pay attention to that bicipital groove. Open hand pec sweeping. Just kind of warming some stuff up, but also doing fairly therapeutic activity. Bicep sift is what I like to call this. Now, the thing about pecs is you often aren't going to do them on just your standard client. You want to make sure that you're comfortable with the person, you've got a rapport built up, or that you explain to them this work may not be comfortable, but it's very beneficial. Anytime somebody complains of upper back, shoulder, or neck pain, I often will pay attention to the pecs because they're definitely related. In fact, they might be the culprit. So it's important not to ignore that side of the body. Do some friction around attachment sites, maybe some sifting through the biceps and the flexors of the forearm. A light traction, and then some wrist and hand work. Some good friction, especially for somebody that's a massage therapist, which is what Lauren put on her intake form, because you know she uses these muscles a lot. Now, in a relaxing massage, I would encourage you to do a slow twist and traction of the fingers. In an invigorating massage, we often encourage the shiatsu version, which is a quick, fast pop. You're tossing out, ooh, nice crack, bad energy. but it's a little bit abrasive, so I don't use it in terms of relaxation. Frictioning the top of the hand, doing some wrist sort of flexibility, mobility movements. You can stretch the wrist lightly because this is not a very comfortable position. You can also stretch the pecs. I'm supporting her wrist, not doing anything else with it. A nice pec stretch again. Kind of moving into some lats and some subscap. Make sure your client stays draped at all times. I'm going to rotate this up and over and push it down. Again, some pec, maybe some teres and lats involved. I don't press right on the elbow, I press just above it. A nice form of shoulder range of motion is to come over across the body. Grasping your sheet, you're going to have your client take a deep breath. And as she exhales, you lift her up and over. Use your body to make this move happen. You can actually grasp the edge of the scapula, pulling those rhomboids, really involving the arm in the stretch. Gonna lift up, toss that sheet so it doesn't get stuck, and then do a nice form of shoulder range of motion by coming all the way around. At this point, you could do some flat iron. You've learned different ways to do some of the back routine in a supine position for people who are not comfortable lying face down. This would be flat iron. I'm in a nice deep squat. I don't want to be bent over like this. I want to be level with the table. My body should be supporting me. As you can see, I'm hooking into the edge of the rhomboids and pulling that scapula away. That's a nice friction piece for getting into those rhomboids. At this point, you can either leave the client's arm out or redrape it to signify that you are done with that portion of the body. I like to always end with a little bit of compression. In my opinion, it's a nice way to say bye-bye. And on to the next arm. Couple pumps of oil, nice long flowing effleurage, warming up the pec, getting into the bicep. Everything sort of moves nice and flowy. It should connect. You should be able to transition easily. Your client should never have to wonder where your hands are going next. So on this arm, I'll remind you of your acupressure points. You've got large intestine 15 here, right at the edge of the acromion process. It's great for shoulder pain. A little bit farther down towards the elbow, you've got 3 major acupressure points. You've got a large intestine 12, large intestine 11, and large intestine 10. All of these are good for, as you can imagine, elbow pain. Other types of arm pain, fever, things like that. Pop the arm out so we can do our nice bicep moves and our open-handed pec sweeps. Now, if Lauren was here for a therapeutic sports type massage, you could actually get way more involved in some of these pec moves. If there's comfort and a rapport built up, you can actually grasp and sift the pec muscle toward yourself. This is not always comfortable, so again, this needs to be for a client that was prepared for this type of work, is an athlete, or that you have a nice rapport built up with. Stripping that bicipital groove. Anything tender, Lauren? Are we doing okay?
Oh, very tender, actually.
Oh, I'm sorry to hear that. Would you like me to back off some, or are we doing all right?
Pressure's okay.
Okay.
Still able to breathe through it.
Very nice. And that's the key with deep tissue. As long as your client is able to breathe and nothing tenses up against you, I'm all for just a little bit of discomfort. Some wrist work like we discussed on the last arm. But while we're here, we'll do some acupressure points. On the inside of the wrist, just below, is pericardium 6. This is good for motion sickness, seasickness, things like that. Right here in the middle. Inside the palm is pericardium 8. This is good for hysteria. in between the webbing of the thumb and the pointer finger is large intestine 4. This one is very important. This is the great eliminator of upper body pain. It is used for so many things. If you remember no other acupressure points, please remember this one. Headaches, colds, fevers, any pain in the upper body at all. At the edge of the pinky is small intestine 3. So if an acupressure point feels bulbous, you try to sedate it with a little bit of pressure. If it feels like it's sinking, you try to invigorate it with a little bit of jostling. And then we'll move into our nice finger range of motion. A nice traction for the shoulder. I'm using my body weight to make that move happen. And then we'll move right into stretching the pecs. More pec stretching. Some nice rotator cuff. Teres muscles much tighter on this side. Sometimes I'll even do a nice traction and pull here for the lats. Up and over the body. Remember, we're going to ask our client to take a nice deep breath. And as she exhales, we'll roll her towards us using the strength of the shoulder, not by pulling the arm. While I'm here, I'm going to press down, give those deltoids and that rhomboid a nice stretch, and hook into the rhomboids. As I come back, I release the sheet, rotate the shoulder through its complete range of motion, hook and pull back to neutral. This time, you can move into some nice flat iron, just like on the other side. I'm scooping not just through the rhomboids, but actually through the whole scapula, getting into infraspinatus, supraspinatus, introducing some blood to an area that will work very shortly. Again, I like to redrape the body parts that I have completed. It signifies that I'm done. If Lauren's warm, she can always take her arms out herself. I like to do a nice compression and say goodbye. Now, moving into the leg. As you can see, my routine is face and neck, scalp, arm, leg, and then I'll do feet. Some people believe in completing a nice full circle. They would do arm, leg, arm, and then finish with feet. Completely up to you. Whatever follows your logic or makes you feel that you are doing a good transition is good. Doing a little compression near the psoas muscle and the attachment sites of the quadriceps. I'm going to do a nice little compression and jostle, saying hello, if you will, to the body part you're about to work. Now, I like to undrape the blanket completely so it's not in my way at all. You have to remember the blanket does not get changed every single client, so we try not to touch it as often as possible. Now with undraping, obviously you'll just be practicing that in class, so you'll just get to witness my draping as we go. I always like to kind of medially rotate the leg so that I have access to the tibialis anterior. Some people's leg will stay like this naturally. Other people's you'll have to pick up a little wedge pillow and stick it under here. All right, just like normal, some effleurage. Some fulling. Some friction fulling along the ITB. At no time is it appropriate for your hands to go underneath the sheet. The line of demarcation is the drape. This is how you instill confidence in your work and a sense of trust with your client. You showed them where the line was. You promised not to pass it, so don't pass it. If you need to work something higher, you need the sheets to be out of your way, simply pick them up and redrape them. If it feels like it's too intimate of a spot, make sure to communicate that. I need to be a little bit higher here to get this knot or to work this muscle effectively. Is it okay if I push the drape up just a little bit, right? Or if it's a man's boxers and they're down to here, you can ask his permission to move his boxers up so you can access more of his thigh. Some nice friction around the knee, getting all those attachment sites. Myofascial skin rolling. Feels great. Ooh, poppy clicky. Make sure as you go through your massages, you're paying attention to what you feel. You're not just doing the moves that you were taught, but you're feeling what the muscle is doing below them. Use that information wisely. Stop. Focus on an area that's giving them problems. Give it some extra love. Some traction. And then some acupressure points. So we've got stomach 36 here. That's called your 3 more miles, your endurance point. You've got spleen 6 about midway through the medial portion of the calf. Just above the pes anzerine, you have spleen 10. And we'll just effleurage out. I'll show you some leg stretches on the other leg. Normally, if you do stretches on one side, you must do them on the other. It's fairly obvious to the client that you forgot something if you only do stretches on one side. But for sake of time, we'll just be demonstrating them on one leg. Nice jostle and compression to say hello. And then I'm going to use my nice business fist to do some nice compression on that psoas and the quadricep attachments. Now, for clients you've not worked with before, this is fairly appropriate. But if you've built up a clientele, or a rapport, with your clientele, or they're an athlete, or they're here for more therapeutic work, you could actually start by using your fingertips. Keep in mind this is a very goosey spot. It can often be ticklish. Not everybody will be able to handle fingertip work. Sometimes it'll have to be stagnant. Sometimes it can be aggressive frictioning. Just depends on what they're capable of breathing through. This is the knee, right, Lauren?
Yes.
Okay. So when you're doing your intake, if you find out about any illnesses or injuries that your client has had recently, that should dictate how your massage goes. Lauren informed me that she has a right knee injury and that there's a little bit of swelling and pain. Swelling and heat are contraindicated. Since I don't see those, I'm just going to do a light effleurage and nothing very specific here. So we'll eliminate that nice myofascial release that we did on the other side. Effleuraging, making sure we're covering all of our bases, coloring in the lines, don't want to leave anything untouched. This is some nice two-handed kneading. The majority of my pressure is through my thumbs on tib anterior because there's not as much muscle on this side of the body. Fulling. Fulling. I'm going to tuck my fingers in so they don't go below the sheets. And then I can actually do some two-handed kneading up here. The adductors, the quads, the ITB. Lighten up my pressure over the knee, just some nice scooping effleurage. Friction along the ITB. Is we teach you a bunch of moves for every part of the body, and you find what works best for you. It's not about quantity, it's about quality. So once I feel that I've completed my leg routine to my desired specifications, we'll move into some leg stretches. So the key here is just confidence. Cradle the leg, bend it, grasp your sheet, pull it up, keep them covered. You can tuck in, or if it's more comfortable, you can actually ask them to hold it. For right now, I'm sufficient with what it's at. I'm gonna watch that drape as I put them through. their hamstring stretches. Because of the knee injury, we're going to go light with these. But it's important that you understand that you're needing to be able to feel infield. And then have a nice communication line open with your client so that they feel comfortable communicating to you if you have or have not reached the infield of the muscle. You can ask things like, is this stretch far enough for you, Lauren?
Yes.
Wonderful. So we're going to step back. We're going to make sure she stays draped. I'm actually going to ask her to take her hand out and hold outside here for me. And I'm going to put her into a nice hamstring stretch. We want the leg to stay as straight as possible. If it starts to bend, we'll know that we've reached the end. And then some nice range of motion. Hold that sheet tighter for me, Lauren. Gracias. And lastly, a nice piriformis stretch, which I will take control of the sheet for. Depending on how flexible you are, you can do this from the other side of the table. Just depends on what your client needs. Once you've completed, undrape efficiently and smoothly. Jostle to say goodbye and redrape them around. Bring your stool down to the edge of the table. Either have some cream handy, some lotion, some talcum powder, or worst case scenario, use your oil. But I will tell you that oil is usually too thin of a medium. Now normally I would do both feet, but for the purposes of timing today, I'm just going to do one. But I usually say hello to my feet together. In a normal full body routine, you often only have 3 to 5 minutes for the feet, so this is not going to be that full, nice reflexology routine you were taught. While you're doing the footwork, you can incorporate your acupressure points. So up here in the webbing between the big toe and the second toe is your other greater eliminator. This is called the greater eliminator of lower body pain. It is liver 3. It will help with chest colds, headaches, pulling energy down to this point and away from the upper body. It also eliminates any pain in the lower body. On the inside, just behind the ankle, before you get to the Achilles tendon, is bladder 60. On the outside, same spot, but on the outside of the ankle, so here, is kidney 3. It's possible I just mixed those two up. Some nice circular friction along the ankle. So because you only have 3 to 5 minutes, you really need to choose which moves mean the most to you or mean the most to what's going on with your client currently. So because she complained of shoulder and neck pain, I'm definitely paying attention to the shoulder arm reflex area, the neck reflex area. I did some nice stripping along the sciatic region and paying attention to the whole lower back area. And then just wring the foot a little bit, do some ankle range of motion. And I always like to end my foot routine with a nice gastroc stretch. My whole body goes into this stretch. And to say goodbye, some shaking. Okay, so say we'd finished both feet. It's now time to get our client turned over onto their back. Couple ways you can do this. You can start by taking the bolster out so that it's not so cumbersome when your client goes to flip. And I like to do that because, especially for elderly clients, it makes it easier. So I say, can you just lift your legs a little bit for me? And I do slide my hand under, and then I just take the bolster out, set it off to the side. Before you do any sort of movement of any kind, this is, again, the only time it's appropriate to break contact, really. Make sure that you're ready for them to flip over. So that means finding the face cradle, which is usually kept under the table, putting it in place, being fully in control of the sheets before you do any sort of communication whatsoever in regards to flipping your client. So I have a nice flat line. I press my legs up against it. I check in with Lauren. How are we doing so far?
Doing great.
Temperature and pressure are still okay?
Yes, they are.
Wonderful. Am I addressing all of your needs?
I am.
Do you have any questions for me?
Nope.
Wonderful. So I'm going to reach across the body, grasp the sheet at about the shoulder and about the knee and hold it up for her. Lauren, please go ahead and flip over onto your stomach and kind of scooch up into that face cradle for me. Wonderful. Are you comfortable in this position? I always check to make sure they're comfortable, right? Sometimes it's face cradle is not at the right angle, or the table is not soft enough for the breast, so I often have an extra pillow available for that. I'm also going to ask her to lift her ankles, and I'm going to slide the bolster in. I want it to be kind of right at the curve of the feet. I don't want it to be way up here where the foot is not supported, and I don't want it to be hyperextending the ankles either. So, right in that nice crook of the top of the foot. Feet often get cold, so make sure that you have an extra blanket in the room to cover them with, or that they remain covered at all times. Okay, I like to start with the back, but there are some people who feel you just finished with the legs, so you start with the legs. Again, completely up to you. The blanket goes away completely. I can sort of see where I need to be based on the gluteal clef, and you'll get good at that with time. I like to take the sheet back, check for underwear, which I tuck into. If there is none, I just drape it back. I want a nice straight line, nothing that's going to keep coming back to hit me. Then we'll start with some back work. Warm up effleurage. Saying hello to the back and spreading the oil. Now during the flipping process, because it's the only real appropriate time for you to break contact, that is often where massage therapists will take a drink of water, spray off their hands if they feel that it's inappropriate to move from the feet to another part of the body. In every massage room, there is a bottle of non-toxic spray from the aromatherapy shop and a bookcase like this one with all of your paraphernalia on it, so you can grab an extra towel or sheet to wash your hands off with. So fulling, this is actually Fremmer, a form of like a deep transverse fulling. Now remember, Lauren's complaint was lower back. I can't do anything about a disc injury, but she has had massage plenty of times since that disc injury, and she's been cleared by her chiropractor for massage, so we know it's okay to work the lower back. What I won't be doing is any direct pressure right on the disc space in that area, but I will be doing a lot of stuff to the erector spinae group and multifidus to sort of loosen up those attachment sites. Anything that could be causing additional compression. Some nice friction of the iliac crest. Again, no fingers under the sheets. For your deeper tissue needs, you can move into forearm. Because my tassels, this is something to be aware of when you're working, is your wardrobe sufficient for giving complete and comfortable massage? Your clothing should not be touching them at any time like that. They have no idea what that dangle is, so I'm going to tuck that into my shirt. Some nice teres friction. Supraspinatus friction, infraspinatus, rhomboids, some neuromuscular muscle stripping, slow and purposeful. Feel for the individual fibers. Should cause some nice hyperemia. See that lower trap flick? Boop. we do frown upon thumb use, though I do kind of introduce it intermittently, kind of like my dessert move. I love it for a more specific breakdown of that little turn in the levator's gap. But for the most part, knuckles is also sufficient through here, as is the backside of your fist. So because Lauren complained of lower back pain, we are definitely going to pay attention to her PSIS. We're going to strip the edge of that iliac crest. And we're going to sink slowly into that QL region. In class, we teach you to work the QL with the elbow, and that is certainly an option for you. I just prefer to do it with a little bit more pinpoint. And again, the QL work is one of those I mentioned earlier, an uncomfortable work. So mostly only done if you're going to communicate to your client. We can see Lauren sort of having a bit of a reaction. If you do not have a rapport built up with them, that's a giant red flag of, is this work okay with you? Do I need to back off some? How does this feel? Are you doing all right, Lauren?
Doing good. Still breathing.
Wonderful. So the QL comes down like a fan from the bottom ribs and attaches along the iliac crest. So you want to make sure you're paying attention to all facets of it. The work that you learn in class is this. You can introduce some jazz hands, or you can just do sustained pressure. I like to follow QL work up with Terry's work and just slide right into that shoulder work. Pull the arm off the side of the table and slowly strip those Terrys with a little bit of elbow friction. In a full body 1 hour massage, it's appropriate to spend between 15 and 20 minutes on the back, depending on what your client's major complaints are. You should be flipping the body like we did at about a halfway mark. Some therapists prefer to do a full 30 minutes on the back and then just 25 minutes on the front, or vice versa. But really it depends on what your client's complaint is. So some Terrys and some tricep work. Slide the arm up to get those flexors, which we did sort of work in the front side of the body, but not as much as I like to. So I always do some fulling, one-handed kneading, and some nice deep longitudinal stripping. I like to get into the palm of the hand. And sometimes for deeper tissue stuff, especially on a massage therapist, I'll even use my forearm. As a transition to the other side of the body, I like to do a deep longitudinal stripping of the lamina groove. Kind of getting into multifidus here and rotatories. Fingertip pressure, this hand is along to assist with pressure. And it's kind of like just a nice jiggling back and forth movement to create space. You can do this with your elbow. You teach it as the love move. I just feel that it's a little less pinpoint. Certainly the pressure is deeper. I'm going to do some nice neck squeezes before I transition nicely into the other side of the body, which should already have oil on it because you've already done your warm-up. Back into fulling. Frictioning those rhomboids, frictioning the whole erector spinae group, on down to the iliac crest. I often use my second hand as a means of additional pressure or support for my wrist. You always want both hands to be involved. You never want your client to wonder where the other hand is. It certainly shouldn't be dangling along the side of you or picking a wedgie or touching your body in any way, because we're not cross-contaminating our client. If during the course of the massage you have an itch, you use your shirt to take care of that. Arm saws. And some nice circular forearm work for that lower back. I'm going to do our neuromuscular work again. Again, remember on the front side of the body, I noted that this left shoulder was tighter, and I can definitely feel that here through the back side of the body as well. A lot more knots, a lot ropier. So you would spend more time here in the places that you note more restrictions. I personally, in my routines, basically sort of fluctuate between shoulder work, upper back shoulder work, and into the lower back, and then I come back to the next one, so on and so forth. I like to give all this hyperemia a chance to catch up with the effect I'm going for. So I'm going to leave this for a second and come down here to PSIS and work the iliac crest and the QL just like we did on the other side of the body. Remember, QL is intense work. Go slow, watch for client reaction, and communicate with them. Say you get a client who needs the work but doesn't like the deeper pressure. Learn how to communicate with them that this is important for what's going on. This muscle is a major player in lower back pain, and if I don't mess with it, I'm doing you a disservice. If something is tender, that often means it needs work. But there's a fine line between pressuring your client into doing something they don't want to do and making them feel like they have to say yes, as opposed to educating them kindly. Sliding up into my teres work, pull this arm out and off the edge of the table, warm up those triceps. Warm up those teres muscles. Traps and deltoids of triceps. Slide the arm under to take control. Nice flat forearm down the lats up into the teres. Nice job. Stripping the triceps and coming back for more. I noted some nice adhesions here, so we're going to take this a second time through and slow it down a little. Lauren's doing a nice job of breathing through that. Something mean, something nice. I always like to effleurage flush out the parts that I dig into the most to help move that metabolic waste out. Same thing we did on the other side. This under portion arm here just never gets any work, and for massage therapists, it's really important. Getting into that attachment site for the triceps, working that forearm into the hand. You don't have to use your fist, you can use your fingers. You have a nice access to the palm of the hand in this position. And then lastly, my forearm. All right. Stripping the lamina groove. All the way up into the neck. All right, so I like to do some right on the spine stuff, but here through her degenerative disc, we won't do anything crazy. And then we'll just apply a bit more pressure as we go through. Nice serpentine motion through the SPs of the back here. And a nice flat hand compression down the erector spinae, out and across. And some acupressure points. So we've got each PSIS, bladder 32. You can find L2. So usually you just find the waistline coming up that 12th rib to T12, L1, L2, that's governing vessel 4, right on that SP. Right to the edge of the lamina groove is bladder 23. And then in the erector spinae is bladder 47. These are all wonderful for lower back pain, sciatic issues. And bye-bye. Put these hands under, tug this sheet up. I like to do some nice skin folding. You can also do skin rolling. I like to use the sheet because it helps me get a nice good grip. And last but not least, because it's lovely, traction at the sacrum. I also will do a decompression of the glute line to flat fists, sort of just pushing the glutes away from their attachment site along the iliac crest. This kind of serves as my intro into glute work. You notice that at the beginning of the massage, I did make sure she knew she wanted full body. And I said, do you want face, feet, and scalp? Something that you can add in for your newbies is glute work. Some people don't realize that glute work is a part of a full body massage. I often try not to work through the blanket, again, because we don't change it per client. So I'll get rid of that. And I'll work right through the sheet with some gorilla pause, some circular friction along the greater trochanter, warming up the glute muscles, and then going for the attachment sites. So I find the edge of the sacrum with my gorilla pause, and I start some nice, deep, very pinpoint circular friction along the sacrum. Again, this is wonderful for lower back pain. The glutes are hugely tied into lower back pain, and since that was Lauren's complaint, we're going to spend just a little extra time compared to maybe what my normal full body would have been. Once I feel it's warmed up, I'll go in with some nice deep forearm work. Allow yourself to sink into the muscle. Let it melt. Be still. Working my way up from TFL into glute medius, into piriformis. Are you okay, Lauren?
Mm-hmm. Maybe just a little lighter.
Certainly, I can definitely do that. Is this better?
Yes.
I feel that I am now in the middle of the piriformis. There's a major acupressure point in the middle of the piriformis called gallbladder 30. You can stimulate that with a hand wave or a karate chop. It is great for sciatic pain. Alright, I always like to end my glute work with a nice little friction along the ischial tuberosity, which just below ischial tuberosity is bladder 36. It's also where the hamstring's attached, so you definitely want to pay a little extra attention to that. I'm going to compress the leg and show it that I'm on my way. The undraping should go as high as the ASIS, out and across the bottom of the glute. Nice full access to the complete thigh without showing any booty. Effleurage. Now, when you see a bruise on your client, it is important to make sure that they are aware of said bruise. Oftentimes, your clientele may not have anybody at home that gets to see their body, especially the elderly. And it isn't within your ethical requirements to make sure that they know you didn't bruise them and that make sure that they know it's there. Lauren, did you know you have a bruise here on your thigh?
Yes, it's about a week old.
Okay, wonderful. Now, that's important for you to note because say this was big and black and ugly and purple, we would stay about 4 inches away from it at all times. Since it's light and it's not causing her any pain and it's old, I'm just going over it with a little bit of effleurage. I'm never going to dig my knuckle or thumb right into it, but I'm not going to ignore this area altogether. Some two-handed chucking, some friction along the ITB, which is never enjoyable. Notice that my elbow is into my forearm, my body is supporting my movements. Some ringing. Ringing through the gastrocs. Some nice double-handed kneading on that Achilles tendon. Deep longitudinals with your forearm that go all the way up and around the greater trochanter. Less pressure back, no dragging with pressure back. Majority of the pressure should be towards the heart. Lovely. Say goodbye with some compression or some static holds. Redrape, trying not to break contact, so nice little kneading to the feet to transition to the other leg and back up into this glute. I prefer to do glute leg, just my personal preference. So, while not working through the through the blanket, excuse me. Nice gorilla pause. Circular friction along the edges of that greater trochanter. Once everything's nice and warmed up, saying hello to the TFL here. I'll start circling in to the SI. And I'll do some nice transverse friction. And now that it's warmed up, we'll go in with some forearms. Kind of just working your way through medially and then downward towards the leg. Sometimes if you feel your client tensing, they're trying to breathe through it, you know you're working on something, it's nice to provide a auxiliary jostle somewhere. Kind of confuses the muscles a little bit, distracts the body. This is only for that mild tensing. If your person is puckering up against you, you're going too deep and you need to back off some. Sometimes clients aren't good at telling when you need to back off, and so you need to decide for them. Don't forget gallbladder 30, right here in the middle of the piriformis. Now, something that I didn't show you on the other side that I'll show you here is some hip rotation work that you can do for really tight hips or lower back. It's kind of like a soft tissue release, an STR, if you will, of the piriformis. With the leg in neutral, I'm going to sink into the piriformis and bring it into a stretched position. Hold it for a second and bring it back to neutral. Move down a little bit and start over. I'm essentially going to work my way from the SI joint out to the greater trochanter because that's how the piriformis follows. Once I get all the way out to the greater trochanter, I'm going to hook into TFL and I'm actually going to push the leg the opposite direction. And back out here. That's just another thing you can do for the hips. Ischial tuberosity work, that's that bladder 36. And undrape for the last portion of the leg. Make sure that sweet meat gets some oil. Nobody likes the sweet meat to be rubbed raw. Chucking and fulling. Friction the ITB. Two-handed kneading on the gastrocs. Moving into that Achilles tendon. Something I didn't show you on the other side is a nice knee sift. An STR stripping of the hamstring is possible here. Nice flat fist, nice solid movement. And then the back of the leg stretches that we did on the front will now mimic for the front of the leg. You can bring the heel to the glute for a quad stretch. You can involve the toes to make it a tibialis and quad stretch. And for the psoas, you can actually lift their leg a little bit, slide your leg underneath, and pick it up and lean it forward. Make sure that you have a stabilizing hand on the sacrum. And jostle out, recover, and redrape. Once I'm done, I always signify to the client by saying, "How are we doing?"
Doing good.
Lovely. I'm going to step out and let you get dressed. You go ahead and open up that door as soon as you're decent, and I'll be right outside with a glass of water, okay? Don't sit up too fast since you've been lying for so long, but definitely open up when you're ready, okay?
Okay.
All right. And then we exit to give them a chance to redress. Hi, how are you feeling?
Wonderful, thank you so
Lovely.
much.
How's your neck and back?
So much better, much more relaxed.
Very good, very good. I brought you some water.
Thank
I
you
want
so
you to
much.
make sure that you drink a lot of that tonight and tomorrow.
Okay.
Help yourself flush out any extra metabolic waste we've set loose.
Okay.
We usually encourage patients or clients to get in an Epsom salt bath, about a 15 to 20 minute soak, 4 to 6 cups of Epsom salt. It will help you sort of pull any of the waste products out. Plus it's magnesium, which is a natural muscle relaxer. I definitely would encourage you to ice your neck or your lower back, any place that was specifically tender when we were working, okay? Wonderful. It was nice seeing you.
so much.
And you have a wonderful rest of your day.
Thank you so much.